You've got a headache that's been gnawing at you all day, or maybe it's those aching joints that just won't let up. You walk down the pharmacy aisle, faced with a wall of options. Naproxen? Ibuprofen? They sound similar, but which one do you pick? Every pill claims to relieve pain, yet each bottle hides its own story, and choosing the wrong one could mean the difference between relief and an unpleasant side effect. Segment 1. Understanding the basics of NSAIDs. Let's break it down. Naproxen and ibuprofen both belong to a class of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs for short. These are pain relievers designed to tackle the symptoms of inflammation. Inflammation sounds like a big word, but it just means your body's reaction to things like injuries or infections. It's what causes those familiar signs: redness, heat, swelling, and pain. Think of it like a security alarm in your body. Sometimes it goes off when you need it to, like when you're injured. Other times, it's just plain annoying, going off when you're just trying to go about your day. So, how do naproxen and ibuprofen calm this security alarm? They both work by blocking an enzyme that's responsible for producing prostaglandins. Prostaglandins are like little messengers that tell your brain to sound the alarm. By blocking this enzyme, naproxen and ibuprofen lower pain and reduce inflammation. But here's where it gets tricky. While both work in similar ways, they don't work in exactly the same way, and they're not interchangeable. Segment 2. The unique uses of naproxen and ibuprofen. Now that we know the basics, let's get into the specifics. When should you reach for naproxen, and when does ibuprofen make more sense? Generally, ibuprofen is your go-to for short-term, everyday aches and pains. That headache after a long workday? Ibuprofen. Mild muscle pain after a workout? Ibuprofen. It's fast-acting, with relief that usually kicks in within 30 minutes to an hour. Naproxen, on the other hand, has a longer-lasting effect, often up to 12 hours. It's frequently used for more persistent types of pain. So, if you're dealing with something like arthritis, where you need longer-lasting relief, naproxen might be your better bet. And it's not just about duration. For some types of inflammation, such as menstrual cramps, research suggests that naproxen may offer more sustained relief. Segment 3. Dosage and duration. A fine balance when it comes to NSAIDs. Dosing is everything. Ibuprofen usually comes in doses of 200 mg over the counter, but you can take up to 400 mg every 4-6 hours as needed. For naproxen, a typical over-the-counter dose is 220 mg, which you can take every 8-12 hours. Think of ibuprofen as a sprinter, quick, effective, and shorter lasting. Naproxen is more like a marathon runner, taking longer to act but lasting significantly longer. However, neither should be used for extended periods without talking to a healthcare provider. NSAIDs, though helpful, can irritate your stomach lining if taken too often or for too long. That means ulcers and, in some cases, more serious stomach issues. It's easy to fall into the habit of reaching for that next dose, but knowing when to stop is crucial. Segment 4. Side effects. Beyond the label. So, what's the fine print? Both naproxen and ibuprofen carry risks if taken incorrectly. The most common side effects are mild nausea, indigestion, maybe a little heartburn. But beyond that, there's a more serious side. These drugs can increase the risk of heart attack or stroke, especially if you have a history of heart disease. They can also make high blood pressure worse. And don't forget your kidneys. Long-term use of NSAIDs can strain them, especially if you're already prone to kidney issues. Older adults are at a higher risk for these side effects, but the risks can be minimized by sticking to the lowest effective dose for the shortest possible time. It's tempting to rely on these medications for extended relief, but if you find yourself reaching for them frequently, it might be time to have a conversation with your doctor. Segment 5. Interactions. Friends and foes. Here's where things get even more complicated. Naproxen and ibuprofen don't always play nice with other medications. If you're taking aspirin for heart protection, be cautious with ibuprofen. Ibuprofen can interfere with aspirin's blood-thinning properties, making it less effective in preventing strokes. Similarly, Both drugs can interact with blood thinners, antidepressants, and certain types of blood pressure medication. Naproxen and alcohol are another risky pairing. Together, they increase your risk of gastrointestinal bleeding. When in doubt, a quick call to your pharmacist or doctor can go a long way in preventing potential problems. Segment 6. Pregnancy and breastfeeding. Safety first. Expecting or new mothers, listen up. Naproxen and ibuprofen might not be your best friends during this time. In the third trimester of pregnancy, naproxen is a no-go. It can cause serious heart development issues in the fetus. Ibuprofen, while considered safer earlier in pregnancy, is also best avoided in the later stages. And breastfeeding? Both drugs can pass through breast milk, so they're not recommended while nursing. If you're pregnant or breastfeeding and struggling with pain, talk to your healthcare provider about alternative options. Segment 7. Cost comparison. Is price a factor? The price tags of naproxen and ibuprofen can vary, especially if you're looking at brand name options versus generics. For example, a bottle of 60 naproxen 250 mg tablets might set you back around $25, while 30 ibuprofen 400 mg tablets could cost around $11. Keep in mind that you don't always have to pay for the brand name. Generic versions work just as effectively and can save you money. Segment 8. Making the right choice. The bottom line. So, how do you choose? Think about the type of pain you're experiencing, how quickly you need relief, and how long you need it to last. If you're dealing with acute pain or fever, ibuprofen might be the better choice for its quick action. But if you need more sustained relief for a chronic condition, naproxen could be the way to go. Just remember, when it comes to NSAIDs, it's all about balance. The lowest dose for the shortest amount of time will help you get the relief you need while minimizing the risks. Conclusion: empowered decisions. Next time you're faced with a choice between naproxen and ibuprofen, you'll be armed with the knowledge to make an informed decision. Pain is a part of life, but understanding how to treat it safely and effectively puts you in control. Whether it's the headache after a long day or the nagging joint pain that just won't quit, you have options, and the power to choose the best one for your unique needs.